Hey there, I'm Professor McBride, labor nurse, OB instructor, and your guide to everything OB. Let's get to it. The cardinal movements of labor are positional changes that a baby goes through as it descends through the pelvis to be born. These movements are going to have the baby changing positions and adapting to the pelvis shape and size to fit with the least resistance. Our cardinal movements are engagement, descent, flexion, internal rotation, extension, external rotation, and birth by expulsion. And even though we look at these 7 movements individually, oftentimes several of these can be happening simultaneously. So first we'll look at engagement. Engagement occurs when the presenting part, for our purpose, the head, is descending into the maternal pelvis. And so for a first-time mom, this can be before labor starts. With moms who haven't had babies before, the musculature is more firm and can guide that presenting part into the pelvis well. For moms who've had babies before, the musculature can be more relaxed, and we might not see engagement happen even until after labor has begun. So for this, we're looking at the fetal station and where the head is in relation to the pelvis. So the ischial spines is what we call zero station. If the baby is above the ischial spines, then those are counted in centimeters in minuses, -1, -2, -3, depending on how much higher the baby is from the ischial spines. As the baby continues to descend, we're going to start seeing pluses, +1, +2, +3, until the baby is born. Next is descent. And so descent is the progress of the presenting part coming through the pelvis. So descent is required for all of our mechanisms, from the beginning when we have engagement all the way to birth. And so we determine this again by our fetal station. And so the station is going to tell us where the baby is as far as descent goes before delivery. And this can be slow and steady for a first-time mom, and it can be more rapid in subsequent deliveries. Our next is flexion. As the descending head meets the resistance of the pelvic floor, it's going to cause the baby's head to start to flex. It puts pressure on the head and it causes the baby's chin to tuck against the chest, which is going to allow the smallest part of the diameter to come through the pelvis. So flexion is very helpful to help our baby come through the pelvis optimally. If our baby's position is occiput posterior, where the back of the head is towards mom's back, the baby won't flex the same way as if the baby's head is occiput anterior. And we're going to see where we end up with that on our next step, which is internal rotation. So when the baby comes into the pelvis and engages, it usually is in a transverse position, meaning the baby's back of their head is towards one side of the mother, left or right, because that's the widest part of the pelvis at the top. As the head is descending, the pressure of the pelvis and the change of the curve in the shape is going to cause the head to turn, which is our internal rotation. Typically, this is going to cause the head to turn occiput anterior, where the back of the head is towards the anterior, the front of the mother's pelvis. That's going to give us our best flexion to help the narrow part of the head come through. So once this happens, then the curve of the pelvis causes the head to turn, typically to occiput anterior, and then it's going to help guide the head under the symphysis pubis. Extension is our next step, and this is when the head passes under the symphysis pubis. And now the head is going to need to shift from flexion to extension. So the head comes through and we have the occiput showing, and then as the head emerges, then we see the face and then finally the chin. So this is delivery of the head. After the head delivers, we have external rotation. So as the head came through, the shoulders were still at a different angle. So the head is going to turn in relation to the shoulders so that they can realign. So the baby's head will turn to the side, And then once this happens, then the baby is going to rotate further so the shoulders can now navigate like the head did on that internal rotation. The shoulders are going to do that as well. So we see the head now turn to the side and then turn a little bit further to help the shoulders pass through. Then we have birth by expulsion. So once the shoulders have aligned, then the anterior shoulder delivers, then the posterior shoulder delivers, and then the rest of the baby is born. So our cardinal movements of the mechanism of labor are engagement, descent, flexion, internal rotation, extension, external rotation, including restitution, and birth by expulsion. Thanks for watching. Be sure to subscribe, like, and share for new videos every week about everything OB. See you soon.